Good evening. Welcome to a regular meeting of the Fallbrook Union Elementary School District. I'd like to call this meeting to order. It is 6 p.m. I think we've got everybody on board. Okay, great. Now we'd like to consider approving the minutes of our July 17th regular meeting. Do I have a motion to approve?
I move we approve the minutes with, I think there was one correction.
Okay, and the correction being?
I do not remember. It was in an email that came out. I think it was just a date, if I recall.
Okay.
It was the start time of the closed session special meeting. So it's for the
Okay.
next one.
Thanks, Stephanie.
Okay. So it's acceptable as it is then, because we didn't get to closed session. All right. So we have a motion from Mrs. Lopez. Do I have a second?
I'll second.
Thank you. Let's do a roll call. Mr. Favela,
Aye.
Mrs. Liebes,
Aye.
Mrs. Lopez,
Aye.
and Mrs. Lieber,
Aye.
and I vote aye. So we have the minutes of the July 17th meeting approved. The August 9th special meeting. And Mrs. Lopez, is this the one that has the correction for the start time of the closed session?
Yeah, that's probably it. Yeah.
Thank you. Okay. Appreciate that. Do we have a motion to approve the minutes with the correction as noted?
I'll make a motion to approve.
Thank you, Mrs. Liebes. Do I have a second?
I'll second.
All right, Mrs. Lopez. Then we will move to our roll call. Mr. Favela,
Aye.
Mrs. Liebes,
Aye.
Mrs. Lopez,
Aye.
and Mrs. Lieber.
I abstain.
Abstain. And I vote aye. Now we come to the community relations portion of our meeting when we receive input from members of our community. And before we begin today's hearing session, I would like to read the procedural guidelines for these sessions, just to refresh our understanding of the rules. So bear with me as I read this. In compliance with the state of California and the County of San Diego public health directives, the governing board will accept written public testimony or live audio from community members. This is the appropriate point in the meeting for members of the public to directly address the board on any agenda or non-agenda item. Comments related to an item on the agenda may also be heard prior to consideration of that specific item. The board shall limit the total time for public input in today's meeting to 2 minutes per person and 20 minutes per topic when we have more than 10 individuals that want to speak on the same topic. For those where we only have 1 or 2 comments, we have time for you to make your normal 3 minutes comment. Written comments submitted to be read by the board clerk, Mr. Favela, will be subject to the same time limitation. Individuals submitting live public comment will have their audio disabled after 3 minutes. Ordinarily, board members will not respond to comments or presentations, and no action can be taken. However, the board may give direction to staff following community input. Mr. Favela, do we have any cards for today's meeting?
Yes, we do. We have quite a few.
All right. I turn this to you.
Sure, and welcome to all who are calling in. I see we have 34 attendees, and along with our staff, and we have a total of 47 participants, 48 now. So welcome you all today. And thank you for commenting. So we'll start off with our first one. Subject number 1, board organization by Eden Besant. And it says, once again, I come before this board to ask for transparency with your recent shuffling of the board. If someone has made accusations that warrant the secret removal of a board president that I support, then I want to know who, what, where, when, and why. This is all starting to seem like some top secret squirrel cabal. When do you plan on telling the people that elected you what is going on? Thank you for the opportunity to express my concerns to this board and administration. Thank you for your service to the community. Eden Besant. On to the next comment, subject number 2, masks in school. And these will be live audio comments. The first one being Jennifer Montgomery, subject of comment, support of continued masks in school. Jennifer.
Hi, can you clarify if I have 2 minutes or 3 minutes? I was confused by the instructions.
2 minutes.
2 minutes, okay. I'm a Fallbrook resident and FUESD parent and PTSA president. We are not here to debate the efficacy and safety of masks. That debate is over and the facts are indisputable. Scientists agree unequivocally that mask wearing indoors is imperative to stopping the pandemic. Just because there are a few loud people who don't want to believe it does not make it untrue. As we saw last year, masking not only kept our kids safe and in person at school for almost the entire year, a feat matched by very few districts, but the vast majority of students did not struggle with masking at all. Indeed, if more adults were as good-natured about basic public health solutions as our kids are, the pandemic would have ended long ago. Our FUESD parent community has overwhelmingly supported and continues to support masking in schools and all appropriate safety measures recommended by public health experts. But even if our community didn't support masking, the board should defer to public health leaders when it comes to a generational crisis that has killed millions. Also, the board should not treat the opinions of the Let Them Breathe group in good faith, as they themselves are not acting in good faith. They are neither a Fallbrook organization nor one organized by local public school parents. They have had no part in FUESD strategies and surveys that thoughtfully sought parent feedback throughout this pandemic. They are not campus volunteers, nor do they know the specific vulnerabilities and needs of our diverse community. FUESD parents support masks. We support science and the guidance of public health experts. In closing, schools have always taken measures to prioritize the safety of our children: fire drills, crossing guards, mandated vaccines against the measles, hand washing. These recent changes are no different. As a parent, it can be scary letting your kids leave the nest and go to school, but what has always alleviated my worries as a mom is knowing that the safety of my 2 young daughters was always a top priority of the school. Thank you for your leadership and for continuing to keep our community safe. Trust the experts, trust the science. Thank you.
Thank you for that, Jennifer. And we'll move on to comment number 2 by Jonah Levis, subject of comment, school safety.
Yeah, hi. Thank you for giving interested parents time to speak in favor of wearing masks in school for now. As the parent of a student in the dual immersion program at May Alice and a long-term Fallbrook resident, I'm in strong support of the district's work fighting the spread of coronavirus. I'm in favor of the mask and even a vaccine mandate for nearly all teachers and students once available. The staff of Fallbrook Elementary have had school open or available virtually more than any other public school in San Diego County. It's amazing to see what they've done. Unfortunately, ill-informed and mistaken people who are against wearing masks in schools are using children as political pawns in their game of herd immunity. These right-wing funded extremists would rather see kids smile than keep them healthy. As someone who recently saw a loved one on a ventilator, I don't want any of our kids to suffer that trauma. Masks and vaccines should be mandated for every person at the school, period. Virtually no local business would bring 30 mostly unvaccinated people into a room without masks. That would be unsafe and not where I want my child to spend their day. Thank you, and I appreciate your effort so far.
Thank you for your comment. We'll move to the next comment by Brittany Tremer, subject of comment, mask choice. Brittany, if you're speaking, I believe you're on mute. Is Brittany on?
I've sent her a request to unmute, but it looks like she's still muted.
Hello.
There you go.
Hello? Okay.
Yes, we can hear you. Go ahead.
Brittany gave me her time. My name is Jennifer. I'm a registered nurse. I'm a pediatric registered nurse for the past 8 years. I have seen the devastation that what you guys are doing to these children has taken its toll. I have seen day in and day out people coming in with mental issues, They want behavioral health therapy because of what you're implementing. These children need to smile. They need to regain their livelihoods, and you guys are taking them away. How dare you tell me that I'm not following the science? This is what I learned in nursing school. This is not a right or left issue. This is a freedom issue. This is a parent issue. This is everything. We are fighting for our children, and God damn you for telling me that I don't know what I'm talking about. I am literally the second leading cause of death of 10-year-olds to 34-year-olds is suicide. And you guys are just going to ignore it because you guys are getting paid by somebody. I am empowering you. Realize and wake up, and I'm hoping that you can regain the faith in our community that there's leaders that are not willing to be paid off, that you guys will do the right thing because these children need our help, and now is the time. You guys seriously need to wake up and realize you will regain the faith in the community. We support you. We back you. Whoever is telling you to do this, it's wrong, and we see it. We have children in these schools. We see it day in and day out. Please do not allow another child to lose their smile. You have the right thing. You have the power to do the right thing. I am not a paid actor. I'm a nurse. You can look me up. Okay? I'm not messing around. We need to help our children. Community wants this. We need to help our kids. Let us in the building. Let them breathe and let them smile. I see it every day, all day. Do the right thing, please. Like I said, this is not a right or left issue. This is a freedom issue. We are the one raising our children, not you. We know what's best for them.
Okay, thank you for your comment. We will move on to our fourth comment by Leticia Maldonado Stamos. Subject of comment, safety of the students and the community. Leticia, are you on?
Good evening. Can you hear me?
Yes.
Very good. Thank you. Thank you, board members, administration staff, and community members. There are lots of things going on in the school districts that are political. Public health shouldn't be one of them. And yet here we are. In the community with a rising rate of COVID infections among children and the unvaccinated, area code, or rather zip code 92028 is in the top group of the highest infection rates of COVID in San Diego County. When given the option by Sacramento to either require or not require or mandate students to wear masks, the choice should be clear. And the consequences of this choice go far beyond the walls and fences of our community's public schools. It affects every single home in Fallbrook, even those that do not have children. To be sure, children's mental and physical health is at stake. Wearing a face mask to protect each other shouldn't be so difficult to explain to anyone, child or adult, or for someone to understand. It shouldn't take more illnesses, hospitalizations, and deaths to get the point across. The school district can make a difference here. A child is sent home when they are sick, or when they have head lice for the health of everyone, or when they wear something inappropriate because that is policy. And if the student's clothing can be mandated, surely a health safety precaution like face masks can be mandated. Unfortunately, the state has put the onus on local boards rather than making the hard decision themselves, so it's up to you. Yes, parents decide what is safe for their children, but even that is up to a point legally. I'm not here to get into that discussion. I'm here to say that in a public school setting, you as board members need to be making the decisions for the good of the whole community. You are going through a great deal of work and effort.
All right, I'm sorry. I think your time may have expired. Thank you for your comments, Leticia. Next, number 5 is a written comment by Paul Baker. Subject of comment, vaccination mandate. And it reads, I would like to thank the Fallbrook School Board for their safe and scientifically backed approach as kids return to school. I was encouraged by the governor's recent mandate that school employees be vaccinated or undergo regular testing, but it doesn't go far enough. I hope the school board will make vaccines mandatory for employees, regardless of testing. As a grandparent, I am concerned about children who are not yet able to be vaccinated, interacting with the teacher or lunch lady who has made a conscious decision to forego the health and safety of the kids in their school by refusing to be vaccinated. Thank you for addressing this urgent issue. Thank you for your comment. We have another one, comment number 6 by Nicole Garnes. Subject of comment, mask mandate. And it reads, I am writing as a concerned parent and community member to voice my opinion in support of keeping the mask mandate in our schools. I imagine you will be receiving opinions on both sides, but I ask that you simply follow the science. Both the CDC and the Academy of American Pediatrics strongly recommend masks for unvaccinated children in schools. Schools were able to remain open last year because of masks. I think we can all agree that having our kids in school is of utmost importance, and the way to ensure that at this time during the pandemic is to require masks. Until science tells us otherwise, we need to continue to protect them by mandating masks indoors. It is my hope that you will take our children's and the community's health into consideration and to allow the science to lead your decision. Thank you for your time. Thank you for your comment. The next comment is live by Aubrey Doss regarding mask choice.
Mr. Favela, I do not see Aubrey on currently.
Okay. All right, we'll move on to another live comment by Algeria Porte, perspective on mask choice.
Hello, you hear me?
Yes.
Yes, good afternoon. My name is Algeria Porte, also known as LJ. I am speaking in simply a change of perspective, getting myself nice and clear. Change of a small perspective switch. There are many people with a lot of opinions on the subject. Right now, quite frankly, the world doesn't know what to do. But I can say one thing, as the youth is in desperate need for an advocate that will speak for them for the next years to come. I would say to the board members, at your age and wisdom in life, if it was up to your parents to make this decision, to either have to administer something that has not been tested into this world, that has not been proven, that kids necessarily are suffering in certain ways, would you allow this, or would you want this to be allowed for your generation coming up? This is a new generation where the world is absolutely shifting. Kids need an all-time advocate at this point. I cannot sit back and say that I necessarily am for anything of the mass being, allowed for these kids. These kids are a very precious, important part of our lives, part of everyday lives. But the decision to allow the lawmakers to make this decision is absolutely, it contradicts everything. The parents need to be able to make this choice. You guys are in positions for a certain reason. Past that, this is something new. And honestly, the parents are the ones that need to make this decision. We cannot allow this as human society. Beyond that, I don't have anything written, but this is just from the heart. You know, the kids, it needs something more strongly put than.
I'm sorry, I believe your time has expired, but thank you for your comment. We'll move on to the next comment by Marie Sanchez, which is a written comment, and it reads, I was angry when I heard of the planned Let Them Breathe protests at the district central office prior to tonight's Board of Education meeting. Sharon McKeeman, the proud founder of the bully organization Let Them Breathe, states on the organization's website, you have very low rates of serious COVID complications and adults are now eligible for the vaccine. What does she consider an acceptable rate of serious COVID complications, or even worse, deaths? Would she care to tell us specifically which children she's willing to sacrifice? So-called leaders at every level of government have politicized a public health emergency with their rhetoric, leading to a vicious resurgence and a large swath of the adult population who refuse to get the vaccine. Her organization uses words like freedom, pro-science, and mass choice, but distorts their data and purposely shares out of context information in an effort to intentionally mislead. Do not let this group, who has embarrassed themselves at the meetings across San Diego County, dissuade this board from continuing down the effective path laid out last year, allowing Fallbrook schools to open earlier than almost every other school in Southern California. I ask you to continue the mask mandate while indoors at our schools. Thank you for your comment. And we'll move on to another subject, COVID vaccination clinics. This is a live comment by Leticia Maldonado Stamos. Leticia?
Yes, good evening. Do I have 2 minutes or 3 minutes, please? Hello?
Three.
Three.
Okay, very good. Thank you. For many months, we have been working with health groups to make vaccination clinics more accessible to Fallbrook residents, particularly those who are most vulnerable and the most difficult to reach. The village of Fallbrook has one, as I mentioned earlier, of the highest infection rates at this time of unvaccinated people in the county of San Diego. After much encouragement and urging, the Fallbrook Regional Healthcare District and CAL FIRE hosted a vaccination clinic last Friday at May Ellis. This is something that we have been pushing for months. There are a couple of concerns that I come to this board and administration with this evening. First, it appears as if the Fallbrook Union Elementary School District was not as receptive to the idea of having a clinic at May Ellis, because I was told that the healthcare district staff only finally received the okay and go ahead a few days before the clinic was to take place. While we all understand that processes and procedures need to be followed, when we are in the midst of a public health crisis, which at this point is getting yet worse again, one would think that something as vitally important as a vaccination clinic would be given priority and fast track. There are school districts in North County which recognize their role in keeping families and communities safe from COVID, and as such were hosting clinics at school sites when parents were invited to register their children, when meet and greets were being held at the sites, and other events when parents and children over 12 would be present to take advantage of the opportunity to inform, educate, and vaccinate. When I learned that the clinic was taking place, I went to the district's website, and while other COVID information was present and available for parents, this particular clinic at the school site was left off. I and many others in Fallbrook found that tragic, a lost opportunity. I talked with a few parents on Friday, and none had received automated calls or text reminders. And people in the downtown neighborhood could have walked there. Our children started school today. We don't want to have happen here, but it's happening across the country. Children falling ill with COVID by the scores, and they're taking the infections home to their unvaccinated family members and more vulnerable family members. Fallbrook Union Elementary School needs to be a full partner in the fight against this virus. As a community, we should expect no less. There is another clinic to be held at May Ellis on September 6th and another earlier at Potter. Let's not lose another opportunity. Please do everything at your disposal to inform parents about the importance of vaccination and of the convenient clinics at May Ellis and at Potter. We appreciate the hard work, effort, continuing following the protocols to keep our families and our community safe, and we just want to thank you for that.
Thank you for your comment. And then we have one more comment regarding data. And this is a live comment by Colleen Carta. Go ahead, Colleen.
Can you hear me?
Yes.
Hi, so thank you. I want to start out thanking the board that last summer you sent out, or was the school district, the superintendent as well, sent out a survey to parents asking what they wanted for the school year. And I was shocked, along with many other parents, that 85% of parents wanted their children back in school full time and even without masks. This was last summer. And I felt that the school district really heard those parents and did everything they could to get them back in. You were at the front of the line, you were leading leading the entire county by getting our children back in class. I am a teacher in another district, and we did not do that. And I can tell you as a teacher and a parent how much that benefited my child. And I am so grateful and so appreciative of the hard work. And I know it's hard to do what you did. So coming from that, thank you is not a big enough word. This year, I feel like there's been less of that, asking families for their input and to really find out where people stand. You don't have data that I can tell, because I haven't gotten a survey about whether parents want masks or don't want masks. Who knows what the percentage is? And I think that you might be surprised. I don't know. So I'm asking that the school district or the superintendent put out a survey to parents so that you can have that data available. When you have data and not necessarily just, oh, the CDC says this or that person says this, that changes, and it's very subjective. The hard data, also putting out the science that you're using to make the decision. So if you are making a decision to keep masks or to not keep masks, that data, that study, whatever it is that you as a school board member or the school district is using, that should be public and transparent for parents to see, so that they can make the, either have a good argument against or be raw, in favor of. But it really is important for you to be transparent. Put those surveys out to parents. You might be surprised of what their wishes are. And you were so great at doing that last year. And I think that helped us motivate to get our kids back into classrooms. So I really think that asking parents to have that input, they are our children. And as a teacher, I also am in the classroom and see how difficult it is for some kids. And that should be the parent that gets to have that input into it, along with the school and understanding what's going on. Today was my first day back, and it's hard for those kiddos. I will tell you that. So please be transparent, do a survey, find out what parents want in our district. You did such a great job last year. Let's keep this year the same way. So thank you again for all your hard work.
And thank you for your comment. And that's the end of our comments.
Well, thank you to all who provided your perspectives today. We really appreciate your taking the time to write in or call in, and we're delighted to have your input. Talk about being delighted. I am so thrilled that we're having our board meeting today on the first day of school. I know my colleagues on the board share, whoops. How do I turn this off? Sorry about that. I know my colleagues on the board share in the excitement of today, and join me in acknowledging the dedication and commitment of our district staff, teachers, and administrators who care so much about our kids and their families. We really salute you, and it was a fabulous day. And I think we'll hear more about that later in the session from our board and from some of the folks who are going to be doing a presentation. Mrs. Lieber, would you like to begin with your report to the board?
Yes, thank you very much. Thank you, President. I would like to say that I had the opportunity to visit Fallbrook STEM Academy, and it was just a wonderful, wonderful visit. I got there early enough that I actually got to watch all of the support staff walking students to their classrooms. And then Mr. Rodriguez and I and the assistant principal took a tour. It was really a nice event with a balloon arch and parents giving kisses to their kids right at the gate. And it couldn't have been any nicer. So Dr. Singh, I appreciate you putting that together for us. And I look forward to visiting La Paloma tomorrow. And that's the end of my report.
Mrs. Levis, would you like to give your report?
Sure, thank you. I was at Potter this morning, and it was great to see the staff. Everybody was hustling, getting kids where they needed to be. The teachers were so enthusiastic, and so happy to have the students back. It was fun to see the difference between the 7th and 8th graders. The 8th graders are, walking around very confident, like they're in charge, and the 7th graders have that kind of deer in the headlight look. So it was fun to walk through classes. Mr. Morris and I got to visit some classes and talk to a lot of teachers. So it was great to participate in that. I appreciate the invitation. I was also able to attend the new employee certification last week, and that was exciting to see all the fresh faces at our schools and the many new teachers we have, which is just a great reflection of that we're keeping our class sizes lower, which I think is so important. And then I also did a webinar with the CSBA summer series on COVID, which had experts from the San Diego County Office of Education and Dr. John Bradley, who's a pediatric infectious disease specialist at Rady Children's Hospital. And they shared a lot of the current research, latest research and statistics. It was very informative. Told us what, a lot of what we already know, that children generally have less severe symptoms when they have COVID, but they can still spread the virus to their teachers, their parents at home, grandparents. And there's not a lot of info on long haul COVID in children. Nobody really knows how it's going to affect them in the long term. One thing I didn't know that I learned was that adolescents, ages 12 to 16-year-olds, can get just as sick as adults from COVID. Fortunately, they are eligible for vaccines, but most of our students are under 12. So they are not going to be able to get those vaccines, and pediatric hospitalizations are on the rise, unfortunately. They talked a lot about the mitigation measures, which we're already doing, and especially masks, and how essential masks are to prevent the spread of infection. The doctors reiterated masks protect children. They do not harm children. Right now, there was a lot of talk about Delta. They said right now, 95% of the cases in San Diego County are Delta. It's much more contagious. And anyone who's susceptible, if they're exposed and they're not protected, they are going to get it. One of the experts from the County Office of Ed, Bob Mueller, also pointed out some of the adverse effects of, if not all children are wearing masks, that's another thing, unfortunately, that children can use to bully or ostracize each other. So another good reason to have all children wearing masks. And of course, it came up the mental health toll. We all know how terrible it was last year when we were in lockdown, and that we know we need our students to be in school. And the way we're going to keep them there and keep our schools open is by making sure that everyone is wearing masks. And lastly, on a personal note, my youngest turned 12 this summer. So I'm very, very grateful that both of my kids were able to get both of their vaccine shots the summer before school started. And my 12-year-old does not like needles, like really doesn't like needles. So it was really difficult. But I kept reminding him that we have, we're doing this not just to protect ourselves, but we have friends who maybe can't get the vaccine for medical reasons, or even with the vaccine are at high risk. And so we're doing it to protect them and the rest of our community. And that's what we all need to do right now. That's my report. Thank you.
Thank you very much. Mr. Favela, could you give yours?
Sure. Just like everyone else, I'm very excited about first day of school. My two youngest ones were very excited to come back to school. My now 14-year-old, who's now in high school, wasn't so excited, but she went. She had no choice. But something about my 14-year-old, she's a freshman in high school. She was in the dual immersion program since I guess since first grade. She continued through Potter and is continuing at the high school. She's starting at Spanish 4 in high school. That's tremendous. I remember I'm a native speaker. I think I didn't get past Spanish 2. But I just think that's a testament to how great the dual immersion program is at Fallbrook Elementary. So very thankful for that. I had a chance to volunteer at May Ellis this morning. Had a chance to welcome families, all the really was curious to see how the kindergartners were coming to school today. And was really glad to see how organized May Ellis was in getting them an escort or making sure they had a meetup place for their teachers, right? So really good to see school back in action full time. I did forget what time a full day ends, so I had to be reminded, but I'm really glad to see that. I'm really happy overall with what our school district is doing. And looking forward to visiting with more schools in the future. I'll be at Fallbrook STEM tomorrow. And finally, I need to put the plug in for sports. This is the time to sign up. This is the time to sign up for fall ball, fall baseball, fall softball. Soccer is going on. Please take advantage of that, and let's keep our kids active and away from devices as much as possible. Right, and that's it for me.
Thank you very much. Mrs. Lopez.
Pretty much the same. I also attended the new employee orientation, which was really well done. And I was just amazed at the number of new employees that we have because we have reduced the class sizes, and they all just seem so energetic and ready to go and very young, which is good, I guess. And then today I was able to go to Mary Fay Pendleton, which is our newest school, and it was absolutely incredible. It looks like a small college, and they had it running just with a precision that was unbelievable. They had 3 different start times, and all the students arrived when they needed to be, and they had plenty of staff there helping them find their classrooms, and everything went off without a hitch, even though there's still some construction going on. The parking was a little bit farther away than normal, but the parents and the students did fabulous with that. And then we were able to walk around a little bit and go into some classrooms and see some of the first day orientation. So it was a fabulous day. I too will be at La Paloma tomorrow, so looking forward to seeing how that goes, and just checking in with everybody the rest of the week. It is so exciting to see people back in the classrooms and have the kids be excited to be there.
Thank you. Well, Mrs. Martin and I had the pleasure of being at William Fraser this morning, and there is nothing that beats seeing the little 6-year-olds as they're going to kindergarten for the first day, and how different they are. You know, the little ones who sort of skip up to the front door, and then the other one who's kind of hunched over and scared. And the sweetest thing was when you would see a child like that, very often one of the children next to them would kind of lean over and kind of say, "Come on, come with me, I'll show you where we go." And it just was great. It reminded me of the magic of what we do. Because it's just amazing to see those kids, and then to chat with some of those going into the 5th and 6th grade, and they're just so proud because they've come this far, and they're smart and excited, and it was just wonderful. I think it was hard for us to leave because once all the kids came, it was like, wait, there's nobody else. We want more. So that was terrific. Great way to start the day. I also went to the new employee orientation. I really want to commend the Human Resources Department and the presenters for doing such a fabulous job. It was really well organized and very exciting to see part of it. So congratulations on that. And that is my report. Dr. Singh, we'd like to hear your report.
Thank you so much, Mrs. Lundeen, and thank you to all of our governing board members. Your comments are heartwarming for all of us to hear, and having you all in our schools this morning was wonderful. We'll look forward to seeing you again tomorrow and in the coming days. We had a beautiful opening, and as you watch it, I've said this many times to you and to others, that sometimes when everything looks easy, we think it is. And our school staff, our classified staff who worked all summer to be ready for our schools to open. The grounds are amazing. Our facilities are prepared and ready to go. Supplies are in the classrooms. All of those things happen because of the support staff that spends all summer making sure that those things happen. And then all of our teachers come back and participate in professional development. And along with our school administrators, obviously. I love watching, as you've all described, it's a well-oiled machine when you watch all of these kids walking in the rooms, and it happens because of the team of people that work side by side with each other to make that happen. Today was my 11th first day of school in our school district, which was fun I've been in almost every one of our schools today. My my feet kind of wore out by the school, and I'm so excited to be back in our schools again tomorrow, and look forward to seeing those of you who can do that with us. So we have a short, Mrs. Lundeen, we have a short presentation for you that'll tell you a little bit more. Mrs. Norby and Mrs. Martin and I coming up here in our next presentation that'll give you and our community even a little more information about our school reopening.
Fantastic. Well, we're ready for the presentation.
Okay. So let me move on to that. I'm going to share my screen, everybody, so we can, let's see here. So we can get this all set up. Let's see, Kirby. Let's see. Okay. How's that? Does that everybody see that? Mm-hmm.
Yes.
Okay. Awesome. Well, as I said, and we have Mrs. Norby and we have Mrs. Martin, and I are going to give you a presentation this morning of just some of the details that are put in place to have our schools reopen. And as was mentioned by a handful of the callers that called into our meeting this afternoon, we are so fortunate that we are lifting off from a lot of experience from the end of last year. And as you know, we were able to reopen our schools 5 days a week for our kids last year. And so we learned a lot. So we're not rookies at this as we're first starting. Lots of folks around the county are just getting going with things like contact tracing and all the things that are involved in safely having kids back at school. So we're very, very proud to say that we have a teeny bit of experience with this. We were so successful, and those practices are going to continue to serve as the foundation for what we're going to successfully do again this year. We have said this to you at every board meeting, and we'll say it again, that the safety and the well-being of our students and staff is our number one priority. And every single thing that we do and think about is how do we create a beautiful learning environment for our students, as we always have, with at the same time putting together those strategies, those layered mitigation strategies, so that we are also carefully paying attention to the health and well-being both of our students and our staff. So we've put together a short presentation for you. You might remember these. These were really the 6 big areas of our school priorities as we look to open our schools last year, and they remain in place again now. We're going to talk a little bit tonight about instruction, about our focus on wellness, how technology is going to support our instruction as it has. We're going to be prepared with the same high level of technology support for our students, families, and teachers as we did last year. Mrs. Martin's going to talk a little bit about our facilities and our operations, and then we'll close with just a comment or two about our commitment to communication with our families and our staff. So we're going to get started. We're going to have Mrs. Norby talk about instruction, but as I've said to you before, if conditions change, so will our plans. We have been absolutely committed to following the science, the CDC, CDPH recommendations, and mandates of the state of California. We will continue to do those things to keep our students and our staff safe. But as things change, so do we. We stay very nimble and very closely connected to the data and to the guidance that we receive from the San Diego County Public Health Office, as well as the California Department of Public Health. So with that being said, Mrs. Norby, I think we're ready to have you start a little bit about instruction and what our instructional priorities are this year.
Beautiful. Thank you so much, Dr. Singh. I want to echo what everyone has said. It was so awesome to be in our classes today and walking our schools. I was thinking back to last year at this time, and we were all so sad that our students weren't able to be with us in our classrooms, but today they were, and it was a beautiful, beautiful thing. So first of all, we are so excited to be returning to school full-time, 5 days a week, full day of instruction. As Dr. Singh said, we have a little bit of practice in this, and our teachers reminded me of that over the summer. Julie, we got this. We did this last year. We brought our kids back. We were here 5 days a week. It's a longer day, but we did this. So I'm very appreciative of the positive spirit and the can-do attitude that our teachers had as we began to plan for our reopening 5 days a week, full time. We also recognize that it's really important that we focus on the whole child. That was a commitment that our school board made last year as we were doing our budget priorities, that yes, we know that our children are going to come with some need for some extra academic instruction, but we also know that in order for us to bridge that gap that they may have, that we really need to make sure that we're supporting their social well-being in efforts to then support their academic success. And you may remember, if you've attended some of our meetings, that we've increased many opportunities for this at our school sites. We have a social worker that's working with us now. We continue to have full-time counselors. We've added bilingual support liaisons to our campuses. We've maintained our small class sizes. We have a new English language arts adoption program that we're very excited about, literacy coaches, and the list goes on and on. But in-person instruction continues to be our priority, as it has been from the very beginning of all of this. That being said, we're excited about that, but we are also very realistic, and we understand that the pandemic is not over. We recognize that there may be times when students need to be learning from home. We can predict that we will have students who test positive and have to isolate, or that we will have students who are identified as a close contact and have to quarantine. We want our teachers and our students to be prepared for that. We want it to be as smooth of a transition as possible. So although we are prepared for in-person learning, we are also preparing for what it might look like when students are having to learn at a distance, going back home to do some distance learning. So as we have done all along, we met with our curriculum committee. We have a group of teachers. They are across all of our schools, across our grade levels, administrators also from across our district. We came together earlier this month and we said, okay, here's the reality. We're coming back full time. We're excited, but we also know we may have to do some digital learning. And so we want to make sure our kids are prepared for that. Well, the teachers quickly reminded me that this is so much better than last year because at least we have them the first day of school, or hopefully the first week. If you remember last year, the teachers were trying to teach them how to learn remotely via remote. And that was very, very difficult. So our teachers were thrilled that at least we have some time to plan for it. That being said, they wanted the planning to be very intentional, and they want the teaching to be very intentional. So any good teacher knows that the first week or two of school is really spent getting your procedures and your routines down, making sure the students understand what they should be doing in the classroom in order to make it look like that smooth machine that we were talking about earlier. So this year, we're adding a component to that. We're going to continue to teach our students about the necessary routines to be in school and what that looks like. But equally important is digital skills that they may need if they are at home. So making sure that they know that their Chromebook needs to come back and forth in case the next day they might have to be at home, making sure that they know how to log into the Google Classroom, making sure that they know where that mute button is so that when the teacher's talking, they're not being heard at the same time. All of those things that our teachers did beautifully last year under the most extreme circumstances, but now making it very intentional so we are prepared for that. Your teachers will be talking to you at back to school night, and your principal saying, if you have a Chromebook that isn't working, please let's get it fixed. And we have a process for that. If your internet isn't strong and you need a hotspot, we have that for our students. So we have resources for our students so that really the idea is that they will not miss a beat. If we have to go on to distance learning, they're ready for it and they know how to do it. So one of the reasons that we were so successful last year in keeping our students in school was this focus on small cohorts. We lowered our class size. We made sure that our classes weren't mixing with each other. We had zones on our campuses, stable groupings as much as possible. And we want to continue to do that this year. We will continue to maintain our small class sizes. We're going to have our stable groupings. One of the main reasons for this is contact tracing. That if a student ends up testing positive and we have to then contact trace, we want to be able to do it efficiently. And we want to make sure that we are not having to quarantine more students than need be. So if we can very efficiently contact trace who were the 5, 6, 7 students this student was around, then those are the only 6 or 7 we have to worry about. We have some changes in quarantining procedures that I'm going to talk about in a little bit that actually are really good for our students. So even though we don't have the 3, 4, 5, 6 feet social distancing requirement, we all can recognize that the further away from each other we are, and the more that we maximize space, the better. So even though we don't have those requirements, our teachers are thinking about that when they're setting up their classrooms. They're thinking about that when they're making their lunchtime seating assignments at their lunch tables. They're thinking about that when they say, you know what, I could take a group outside and work outdoors. So even though it's not a requirement, we're being very mindful to maximize that at all costs. We continue to offer our 2 independent study options. We have the Fallbrook Homeschool Academy, which is a little bit more parent-driven and less rigid in terms of check-ins that our students have to have, although some of those check-ins have changed based on new legislation, which will be discussed a little bit later in the board meeting. But we still have that program open to our students TK through 8th grade. And then of course we have our Fallbrook Virtual Academy, which is also taught by our own credentialed teachers, but much more frequent check-ins with our students and much more instruction from our classroom teachers as opposed to a true independent study program. Both of them are available for all of our students. So along with instruction, our department in educational services also works with student wellness. So let me just kind of talk to you about what we've been planning for in that area. As we said, the goal is to keep our children in school as much as possible. That's the goal of CDC, that's the goal of CDPH, California Department of Public Health, and it is the Fallbrook Union Elementary School District's goal. The way that we accomplish that is not by doing any one thing, but doing a lot of things, as we saw last year. All of these items that are listed on this list were things that we were very diligent about last year. We continue to promote vaccines. We obviously have our mask face covering requirements. You can see there things that we've talked about already, teaching kids about hand washing, staying home when sick. And I'm going to talk a little bit more about that in just a moment as well. Ventilation, cleaning and disinfecting, contact tracing, and rapid testing, which is new, and I will talk about in just a moment. So first of all, I just want to thank our parents. You were so awesome last year. Again, lots of reasons why we were able to stay open, but probably mostly is that because our parents did not send sick children to school. You owned that if a child was not feeling well, you kept them home. And that made it so much easier for us to stay in school and not have to quarantine and not have to isolate students. So we're asking the same thing this year. We're asking you to check for symptoms at home. If your child doesn't feel well, has a fever, sniffly nose, congestion, maybe a sore throat, trouble breathing, please keep them at home until you've had a chance to meet with your doctor and perhaps even have a COVID test if your doctor suggests that. I would also expand this year to if your child has been exposed to COVID-19 and you've taken them to have a COVID-19 test and you're awaiting test results, if you would keep them home until you get those results back, that would just be better for everyone. That way we won't have somebody coming to school who then ends up testing positive and we have to quarantine other people. So thank you for all of your efforts last year. And I know that we'll just continue that partnership this year. So what happens if we have a positive case at school? This has changed a little bit from last year, so I want to make sure we all understand the differences. Some things are the same. The top 2 are exactly the same. A parent notifies the school. That's typically how we find out. Parent says, you know, my husband tested positive and now my child's tested positive, so I'm going to keep them home. We're like, yes, thank you. So then we know that that student is isolating. If they happen to be at school when we get that information, we isolate them and then send them home. And then the contact tracing begins. And the school has a procedure and people in place that actually have to go through and determine who has that child come in contact with within a certain amount of period of time of them testing positive. This year, that contact tracing has changed just a little bit. And it is more about not just everybody they've come in contact with, but if they've come in contact with somebody within 6 feet for more than 15 minutes over a 24-hour period of time. So that's a little bit of a nuance in that. That takes us then to the modified quarantine procedures. So last year, if there was a positive case in a classroom, the entire class had to quarantine for 14 days. You might have been, your child might have had to do that. They may not have felt sick, they didn't have any symptoms, but out of an abundance of caution, the CDC said that they needed to quarantine for 14 days. This year, there is a modified quarantine procedure available to us. And the change in this is that, first of all, as I mentioned, only those that are identified as a close contact, 6 feet, 15 minutes over a 24-hour period, only they are subject to the quarantine rules. However, if the parents of those identified as close contacts agree to rapid testing over the next 2 weeks, that student can stay in school as long as they test negative and as long as they remain symptom-free. So this is really good news. The even better news is that we're going to be able to offer that testing right on our campus. So if parents agree to it, let's give you a scenario. Sally tests positive, she has to go home. It's been identified that 5 of her classmates were in close contact with her. Those 5 students we have permission from their parents to do rapid testing. We would test them right there at school. It's not the really invasive test, it's just a little swab in the nose. We would test them right then at school. If they test negative, back to class they go. If they test positive, we give them a second test to make sure it's not a false positive. And then we call the parent just to come and take them home for quarantining purposes. So if the parent agrees to this testing and the student continues to test negative and they continue to be symptom-free, they can be in school. They don't have to wait at home for 14 days to see if they get sick. So this is a really good thing that we are very, very happy about. If in fact a student does have to go home, either for isolation or for quarantining, we will continue to provide learning for them, just like we did last year on the hybrid schedule where they might be distance learning. That's what our classroom teachers will be doing for our students. Again, our teachers reminded me during our instructional committee at work where I said, this is going to be kind of complicated because you might have 12 kids in front of you and then 5 that have to go home and 3 that are getting tested. And they're like, Julie, that's no different than when we had hybrid. We had half the class at home and half the kids with us. We'll get it figured out. We're going to have very consistent schedules and kids will know when to log in. They'll know how to get into the Google Meet. They'll know how to get into the Google Classroom. They'll know how to turn in work. I'm like, okay, we're ready. So that's kind of the nuances of some of the changes this year. Another change is that the governor has given a governor's order that was effective this past week that requires all school employees to be vaccinated or undergo weekly testing. We are abiding by that order. We are currently in the process of collecting vaccination information from our employees and establishing testing protocols so that if they are not vaccinated for whatever reason that might be, that then they understand what the testing protocols are and where they can go and get that testing done. I think, Dr. Singh, that completes my presentation. I don't know if you want me to take questions from the board now or wait till the end.
Whatever. Are there any questions at this point? Anybody? For Julie so far, Mrs. Norby? Okay. If you think of any, just jot them down and we'll definitely have time again at the end. All right, Mrs. Martin, thank you. We are ready for you.
Thank you so much, Dr. Singh, and thank you, Mrs. Norby, Governing Board. Thank you so much for this opportunity to share with you. Although the pandemic has so many negative things associated with it, as it should, there's also a lot of positive things that, we take the best practices that we learned from last year. So many of the things that we are doing for our facilities are a continuation of what we were doing in previous years, maybe tweaked, or previous year, I should say, tweaked a little bit because of the requirements or guidelines or mandates that have changed. Regarding the cleaning and disinfecting, the CDC is now recommending cleaning once a day. There is such a thing as over cleaning and using too much sanitizer on things. So what we are doing is we are going to be doing the cleaning once a day, unless it is an area that's been designated that there was somebody who was positive for COVID in. We will immediately bring in our team, as we did last year, to clean and disinfect. High traffic areas like offices, doorknobs, handles, places, and high touch surfaces will be cleaned throughout the day. Thank you to our classified staff and our CSEA leadership team for working with the district on an agreement that allows flexibility so that we can really utilize all of our staff to do what's most effective to be able to keep our schools open. So thank you for that. The disinfecting that will occur, and there is a difference between cleaning and disinfecting. I think I've talked about that before, but the disinfecting will occur in the evening. We won't be doing it during the day. With the return to full day instruction, we're also now providing lunch at school. The kids will be eating at school. And so we need to kind of refocus where our resources are used to be able to focus on some of the lunch areas, the cafeteria areas where our students were not at last year because they had the grab and go meals or the bulk meal service that we had throughout the year. As Mrs. Norby mentioned, there is not a requirement for the 6 feet, 3 feet, 4 feet, or any amount of space for physical distancing. However, we believe that it's a best practice that we continue to do that when and where we can. So we are continuing our lower class sizes, which means less bodies in the room there. And it does also help with contact tracing because less kids that are potentially exposed to somebody that's positive, the less contact tracing and things we have to do. So we're really proud that we've been able to maintain that and continue that, not just for instructional purposes, but also for the ability to have more space in between our kiddos. Regarding ventilation, this has been an area, interesting area, I will say, that we've already complied with, and we will continue to do so, these MERV 13 filters. You can Google it and look it up because I've done it over and over and over again, but it's really a type of filter that traps any kind of contaminants in the air. And so we have outfitted our HVAC units where we can that accept these kind of filters. And we've also made changes to our systems. We did this last year as we did the MERV 13 filters, so that the maximum amount of outdoor air, fresh air, is being circulated in the rooms. I do recall last year mentioning this to you, that we also, in addition to having the HVAC units running, because it is really hot out there, we are encouraging and still maintaining the outdoor air being brought in, and that is by having our doors and windows open. So I did mention my mother and grandmother would be so upset to know that we have the air fully running, full power there, and our doors and windows are wide open. But that is what is recommended by the CDC and the CDPH. Operations now. This is some really good news. I'm so proud, and we as a district are so proud of not only what we were able to do last year in opening our schools, but the things now that we are able to bring back. Transportation. First of all, thank you to our parents and community for being so patient and understanding. This was something that at the time last year, because of the social distancing requirements, it wasn't feasible for us to be able to have transportation for all of our students, but we are excited that we've reinstated it. Masks are required on the bus, and that we're also using seating charts once again to eliminate over contact tracing, I guess I'll call it that. Child nutrition services, breakfast and lunch for all students at all sites, free of charge, no cost. You've probably heard over and over about the need for, having a full belly really helps with that being ready to learn, and having a not full belly can really interfere with that. So we're proud to be able to do that and offer that at our school sites for all students. We are going to continue our before and after school programs as we had in the past at all of our in-town schools. And we are also going to continue the before and after school care at Mary Fay Pendleton. That's new. We did it last year, but this is now a different model a little bit. And so we're just proud to be able to continue to do that. And finally, on the operations area, the subject of non-essential visitors. And I know this can be a little bit of a sensitive subject. However, temporarily, we're not allowing non-essential visitors to our schools. This is for the safety of all, not just the visitors, but for our students and staff. This is a recommendation by the CDPH and the CDC. And we hope to, and when we get to the point that we will be able to allow our visitors and volunteers to come back in, we are looking at vaccinations as a requirement in order to be able to do that for the protection of all involved. So there's lots of good things that, although these maybe everything isn't as ideal as we'd like, there's some really great things that we are so proud of that we're able to continue and add to. Thank you. Any questions? Thank you, Dr. Singh.
Okay, thank you, Mrs. Martin. And last, I'll just end with this. We're really committed, as you know, Mr. Trench, who is our fantastic director of communications, works closely with every principal, assistant principal, and with all of us at the district office to manage our communication out to our families. It's something that we've been getting, just have regular, consistent, very, very positive feedback from our families and our parents about our commitment to communication and the use of our website, social media, text messaging, translation for sure, and some of the school-based communication directly from principals and assistant principals home. We are absolutely committed to doing that, and will absolutely be paying very close attention to making sure that we're communicating opportunities for testing and vaccination out to our community as well. But we are really proud of the work that we've done in this area, and we are really committed to continuing to do that. And then we're just going to close with this, that we just know that we are going to have a great year this year. It will certainly have some bumps along the way, we're sure of it. But we are really committed to doing everything we possibly can to keep our students and our staff and our families safe and healthy. And but as we watched, as all of us observed the kids coming to school today, they were just coming into school like it was any old first day of school, right? And all the kids with coming in with a new lunchbox or a freshly combed set of hair in the morning. Everyone was coming in with big smiles and excitement, and parents just as happy to drop their kids off as the kids were to be there. And we were really, really happy to welcome them. And I know we're going to have a great year this year. So we'd love to take questions from our governing board if you have any questions for us at this time.
I have a question, Dr. Singh.
Sure.
So the quarantine will only happen for students that are within 6 feet of a positive case for more than 15 minutes. Does that mean if you could be in the same classroom with someone, but if you sit on the other side of the classroom, you're not going to be quarantined? Will parents be notified if someone in the class was positive, even if their student is not quarantined?
Yeah.
Okay.
Julie, Mrs. Norby, would you like to talk about that? The same notifications will still exist.
Great.
Yes, that is my understanding. The same notifications exist. Yes.
I would appreciate that as a parent. I want to know, even if I know I don't need to worry too much. I'd like to just be aware.
Absolutely.
You bet. Anything else from anyone? Any other questions? You look around the screen. Okay.
I just wanted to comment on the being able to do the rapid test right there on the school side is really brilliant, because I guess it's a very, very quick, fast test that the student can actually participate in, and it solves so many problems. It's just unbelievable. I just think that's really such a great idea. And so thank you for coming up with that. It's going to keep more students in class more often by having that available through the nursing program, the nurses.
That's right, Mrs. Lieber, thank you for that. Mr. Rodriguez, who is on the call here with us today, has been just absolutely instrumental in getting our testing program up and going. He has been working diligently on this particular part of our program all summer. And it is, Mrs. Lieber, it's going to allow our kids to stay in school. And it's happening through a partnership with California Department of Public Health. And it's to no cost to our school district as well. So it's wonderful, wonderful.
I had the opportunity to walk around with Mr. Rodriguez, and that's how I happen to know a little bit more.
That's awesome.
Because he was so helpful in explaining the process and how the nursing team will be moving around. It's just a beautiful system. And I know, like you said, sometimes things look easy, but they're complicated. This had to be a very complicated process that it sounds to me is going to run very smoothly. So thank you again. That is really part of our mission to keep those kids in school.
That's right. And I love the positive vibes about that, because you have all the best laid plans, right? So we haven't done this yet, but I said to our team earlier today, our folks are just pros at creating systems and processes for things to go well. And that also, just as a reminder, that is an opportunity to participate with parent permission. So those kinds of permission slips will go home, and we'll be communicating those with our families. But we anticipate that our families and parents will be very appreciative of the opportunity to do a quick little test and be able to keep their kids in school and not have to pick them up to go home. Mm-hmm. So Mr. Rodriguez, while you're on the line, thank you. Thank you for your work in helping us get that going.
Thank you.
You bet. Any other questions? I think we're done, Mrs. Lundeen.
That was a fabulous presentation. Thank you, Dr. Singh, Mrs. Norby, and Mrs. Martin. Terrific, really great presentation.
Sure.
Now we move on to board operations. Our first item is the adoption of board policy 6020 regarding parent involvement. Now this policy was presented for first reading at our July 19th board meeting. So it's coming back to us for adoption. Do I have a motion to approve?
I'll make a motion to approve.
Thank you. Do I have a second?
I'll second.
Okay. Now for our vote, Mrs. Lieber.
Aye.
Mrs. Liebes.
Aye.
Mrs. Lopez.
Aye.
Mr. Favela.
Aye.
And I vote aye. It has been adopted. It's been approved. So now we have a first reading, board policy 6158 regarding independent study. So due to recent changes in Assembly Bill 130 and subsequently Education Codes 51745 and 51749.6, our policy is in need of an update to address the new requirements. The required changes focus on the following. Number one, requirement to offer daily synchronous instruction with the teacher of record for students in grades TK to 3 for contracts that are greater than 15 days. 2, a requirement to offer daily live interaction and at least one session of synchronous instruction per week with the teacher of record in grades 4 through 8 for contracts greater than 15 days. 3, a written tiered re-engagement plan for students who fall behind, as well as a process to evaluate students who are not being successful in the program. And lastly, number 4, we are now required to offer 3 types of independent study contracts: 3 to 14 days, 15 days or more, and course-based. Course-based would be if a student qualified to take physical education as independent study. So those are the changes, and that's the first reading. I don't know if we want to have any questions today. We don't need to take any action, but were there any questions that board members had for the staff that are present?
One question that I had, it was just, is PE the only topic that a student can do a full independent study?
That's a good question, Mrs. Lopez. We have Dr. Curcio on the line, our independent study expert on this topic as well. Dr. Curcio?
So currently, when you're looking at course base, PE is the only one we offer because typically it is a course that is required by law for students to have as a core. And often we offer it to elite athletes competitive ranked athletes and that want to avoid injury. So not participating at a school site. In a TK through 8th grade environment, next to that, if a child is going to go on independent study, they're going to be out of school for periods of time, and they're going to miss more than just one class. So this is the option to be in school, but I'm an elite athlete, so now I need my PE requirement done. So in any other way, a course-based independent study really doesn't match the needs of what we have in a TK-8 environment.
Okay. Perfect, thank you.
Thank you very much. Okay, we're moving on to human resources. And the first one is an action item. And it is, as you know, Mrs. Cynthia Martin has been serving as interim assistant superintendent of business services. And we now have before us a 3-year employment contract through which she will assume the role of assistant superintendent business services beginning on September 24th. Now, I believe I'm supposed to read out the following summary of information regarding this agenda item, since it's a contract with one of our cabinet members. It is recommended that the board approve the employment contract for Mrs. Cynthia Martin, Assistant Superintendent Business Services, with an annual salary of $174,478, which is what she is currently earning as interim assistant superintendent. So there is no change in her pay. Fringe benefits in the form of health insurance will be at a maximum cost of $17,399. So do I have a motion to approve?
I move that we approve the contract for Mrs. Martin.
Thank you. And now we have a second. All right. Mrs. Lopez, your vote?
Are we voting?
Yes.
Okay.
Oh,
Aye.
do we have discussion? Thank you for reminding me.
Okay.
Do you have any questions or discussion on this item?
Well, Cindy's done a fabulous job. So thank you, Cindy, for being the interim and now taking on the role. It's wonderful to have you.
Thank you.
Mrs. Lundeen, the only other comment I would add is that, as you know, Mr. Proctor is part of our routine personnel consent agenda. He has submitted his retirement. So this contract is to take place after Mr. Proctor's retirement is official, his last day of paid status in our school district. And we're going to be doing some honoring and recognizing of Mr. Proctor at our next board meeting. This contract for Mrs. Martin, it allows us to have her officially take the role the day after Mr. Proctor retires. As you know, Cindy and Ray have worked together for many years, and Mrs. Martin has just been extraordinary in filling in for Mr. Proctor as he's been on leave. He is headed to his well-deserved retirement. We're so happy for him. We're going to get to talk about that, but we could not be more pleased, as you mentioned, Mrs. Lieber, to have Mrs. Martin officially become our Assistant Superintendent of Business Services. So thank you.
I did want to mention that Ray Proctor is on the call. So I just think he's here, Cindy, to give you a big double thumbs up.
That's
So
wonderful.
too.
Well, thank you for pointing that out. This was always from day one what he had said, of course, pending your vote. This is always what he had said as his plan was to train and have mini-me's. So what a great mentor and friend. And I've learned so much from him that I'm overwhelmed, but thank you all so much for your support.
It's wonderful.
Well, I would echo what everyone has said. You are just an amazing asset to our district, and we're so grateful for your leadership and your help. So thank you. Now we're ready for a vote, I think. Mr. Favela.
Aye.
Mrs. Leeper.
Aye.
Mrs. Liebes.
Aye.
Mrs. Lopez.
Aye.
And I'm very pleased to vote aye as well. So congratulations. Your contract is approved.
Thank you so much. Thank you.
The next item is also an action item. It regards special education program assistant positions. And it's recommended that the governing board approve 17 6.0 hour special education program assistant positions. And Mrs. Singh, if I recall, Dr. Singh, if I recall, we're consolidating part-time positions. I think it was 34 part-time positions into these. So it's an opportunity for us to perhaps entice those professionals who would like a full-time position in a very competitive market.
Absolutely.
Terrific idea.
Yes, exactly. You know, we, as you know, our part-time instructional assistant positions have been traditionally very difficult to fill. The job market has changed dramatically, as you know, for lots of reasons, but the opportunity, we've done this not too long ago, as you'll recall, we did a handful of part-time positions into added full-time special ed assistants for our moderate to severe classrooms. This is the opportunity to do that now, and to have a full-time benefited position. We tend to get a very talented hiring pool when we do that. So we're so pleased. We know that the needs of our students will be more effectively met with full-time folks. Then they're with us and they tend to stay with us. We don't turn over a lot of those positions once a person has joined our team as a full-time employee. So we're thrilled to be able to offer full-time positions for our special needs programs.
Sounds great. Any questions or discussion?
Dr. Singh, is this, are these 17 positions currently, are any of them filled, or will we be filling all 17 of them?
Yeah, we'll be filling all 17 of them. So they're brand new positions.
Okay.
So we'll be collapsing now part-time positions that are currently unfilled into these full-time ones. But once we fly them now as full-time positions, benefited positions, we just dramatically improve the hiring pool when we do that. And people who have a much stronger interest, as Mrs. Lundeen said earlier.
Right.
You bet.
Okay, let's take a vote then, shall we? Mrs. Levis.
Mrs.
We don't have a motion.
Oh, thank you, Mrs. Weaver. We need a motion. Do I have a motion?
I move that we approve.
I'll second that.
Okay. Now we can have our vote. Mrs. Lieber.
Aye.
Mrs. Levis.
Aye.
Mrs. Lopez.
Aye.
And Mr. Favela.
Aye. Aye.
I vote aye. And so, Mr. Morris, the ball now gets thrown in your court, as they say, to you and your fabulous staff. And good luck finding some wonderful people to join the family, so to speak. Okay, that brings us to our consent agenda. Are there any items for which our board members have questions or would like to discuss? Hearing none, do I have a motion to approve the consent agenda?
I'll make a motion.
All right, thank you. Do I have a second?
I'll second.
Thank you. Okay, let's have a vote. Mrs. Lopez?
Aye.
Mrs. Levis?
Aye.
Mrs. Lieber?
Aye.
Mr. Favela?
Aye.
And I vote aye as well. The consent agenda is approved. Under item 7, just wanted to ask if there are any future items for consideration on a board agenda. This would be the time to mention any that you might have in mind, though you can certainly let Dr. Singer or myself know as we get closer to our September meeting. Okay, hearing none. We will now be adjourning into closed session at 7:24 p.m. Thank you. So if those of you who are going to be in closed session can close out of this meeting and enter into closed session. Thank you.
Suzanne,
Yes?
can we take just a quick break going between meetings?
Sure.
Okay.
Let's resume in 5 minutes.
Thanks.
You bet. All right. We are returning from closed session, and I'm going to report out our action. The action taken was we approved the following. It is recommended that the governing board accepted the claim against the district filed by ER. A motion was made by Mrs. Lopez, and it was seconded by Mrs. Lieber. The motion to accept the claim was approved by a unanimous vote of the board. 5 members approved. That is all the reportable action that we have from our closed session. It is now 8:52 p.m. and we are ending our regular meeting. Thank you all and have a good night.
Night, everyone.
Night.
Good night, everybody.